Hi, I'm Dr. Cheruba Prabakar, a board-certified OBGYN and a fellowship-trained minimally invasive surgeon. And I'm so excited to talk to you today about the treatment of fibroids. If you should get treated, when you should get treated, and how you should get treated. So let's dive in. Now, if you're like most people, you figured out that you have fibroids in one of two ways. Either you were getting a scan for something else, like an MRI or a CAT scan for something in your abdomen, and then somebody just said, oh, guess what, you have a fibroid. And then the second way you found out is probably because you were actually having symptoms. You were having heavy bleeding, irregular bleeding, you saw a bulge in your abdomen, or you've actually been trying to get pregnant and haven't been able to, and then your doctor did a study or a scan and found out you had fibroids. Now, regardless of how you figured out you had a fibroid, the first question that a lot of patients want to ask is, do I need to get it treated? I often see patients rushing into my office all scared and nervous and anxious about the fact that they were diagnosed with a fibroid. And the answer to whether you really need to treat it is, it depends. If you're somebody who has no symptoms and a doctor just told you, hey, guess what, you have fibroid, I saw it on some other scan that you had done, and you're really not bothered by it, it doesn't cause you any bleeding issues, you're not feeling a bulge, you don't feel any pelvic pain or pressure, or there's been no issue with getting pregnant, then you actually don't need to get it treated. You probably just want to monitor your fibroid by getting a pelvic ultrasound, every few years, and that's something you can decide with your OBGYN. Now, if you're actually having symptoms from fibroids, then absolutely you want to get that treated, and I'm going to break that down for you. So let's look at it in three different categories. Let's first talk about abnormal bleeding. This is one of the most common reasons why patients want to get treated if they have fibroids. They have very heavy periods, sometimes they get irregular periods, they're bleeding in between their periods, they get heavy cramps, they're clotting, and this can be very, very debilitating to a lot of patients. Some patients need to rush to the ER to get a blood transfusion sometimes. Such bleeding can often cause lightheadedness and dizziness even. And so patients definitely want to treat this. And the most common way to treat this particular symptom is via hormonal methods. So there are many nuances to this, but let me break it down by some categories. So ways to treat heavy bleeding due to fibroids are, birth control pills. You've got the IUD, the Skyla or the Mirena IUD. You have the Nexplanon, which is a rod that's inserted into your arm to help thin the lining of the uterus and help with bleeding. Got medications like Depo-Provera or Lupron, which are injections that can help with bleeding. And you also have a medication called Orion, which is specifically approved to help with bleeding due to fibroids. So these are all hormonal medications that are either progesterone only or a combination of estrogen and progesterone and can help with bleeding. So if you're somebody who is having very heavy periods and bleeding due to fibroids, these are some of the medications you're going to want to look into. Now, let's move on to another category of symptoms that patients often suffer from, and that is pelvic pressure, pain, and feeling a bulge in their abdomen. A lot of patients will say they look down and they see their abdomen actually protruding, or they can't button their pants up over this mass that they feel. Sometimes when they get up in the morning and they're lying down, they see their belly actually rising from this big hard ball. So these are some of the symptoms that patients suffer from and want treatment. In this case, hormonal medications to help just with cycles are not going to do the trick. You actually want to be able to either shrink this mass or remove it. So there is a medication to shrink it, and this is called Lupron. So Lupron can hormonally shrink this fibroid, and this may be just enough to be able to actually get it out via a minimally invasive procedure, either robotics or laparoscopy, instead of having a big incision across your abdomen. So this is something you want to check out. Or if you just want to be done with the fibroid and don't want to have it, there in your body, then the approach is going to be a myomectomy or a surgery to remove the fibroid. And this can be done either robotically, laparoscopically, or if your fibroid really is huge or you have many fibroids, then you may actually need an incision, more like a C-section incision, to remove the fibroid. The third and last category that I'm going to talk about is patients who are suffering from infertility or subfertility due to these fibroids. So there are patients who are trying to get pregnant, time goes by, they go see their doctor, get some workup, and when they do a scan, they actually see a fibroid. Now, if the fibroid is really small and it's actually in the cavity of the uterus, and by cavity I mean the actual space in the uterus that a baby forms, this can be removed hysteroscopically, which is a surgical procedure where a camera goes through your cervix and into your uterine cavity to remove this small fibroid. Alternatively, when patients are not able to get pregnant, they may also find a larger fibroid, and perhaps they were not symptomatic from it in any other way. Perhaps it was not big enough to cause pressure or actually appear as a bulge, and perhaps it was kind of on the outside of the uterus or on the wall of the uterus and didn't really cause any bleeding, but here it is on a scan, and the recommendation often is to remove these fibroids prior to trying to get pregnant, either on your own or via IUI or IVF or other assisted reproductive techniques. And so in this case, again, this would go back to a myomectomy, which I discussed being done either robotically, laparoscopically, or via a C-section type open incision. The final category of fibroid treatment that I want to discuss is a surgery called a hysterectomy. A hysterectomy is a procedure where the uterus is removed. Now, it's important to remember that this has nothing to do with removing your ovaries. That is a separate procedure. So a hysterectomy is removing the uterus and all the fibroids that are contained in the uterus. So for patients who are done having kids, or they've tried a lot of these other methods that we've discussed in this video, and they're kind of at the last straw and they just need to be done with having fibroids, a hysterectomy is a good option. And this can be performed in several different ways depending on the size of the uterus. Often this is accomplished using the robot, or it can be done laparoscopically, or if the uterus is really big with multiple fibroids, then you'll need an open surgery, which is an actual incision on your body. Now, if someone wants to actually shrink the size of their fibroids, but they do not want to have surgery, they're either too scared to have surgery or they're a poor surgical candidate because of other medical problems that they have, another cool technique to look into is the uterine artery embolization. This is a treatment done by an interventional radiologist, and they actually put a catheter through your groin or sometimes even your radial artery in your hand, and they can shoot little pellets that go and block the blood supply to the uterus and cut off the blood supply to the fibroids. And this causes the fibroid to shrink and kind of shrivel up. And so the bulk symptoms that a patient is experiencing will often go away. So this is another technique to look into. If a patient is actually wanting to get pregnant, this is something we advise against because, again, it's cutting off blood supply to portions of the uterus that can then have other pregnancy complications. So you want to proceed with caution if you are still interested in having children. I hope this has been helpful in covering all the treatment of fibroids, from doing nothing to hormonal treatments to just removing the fibroid to fertility treatment of fibroids, and then finally a hysterectomy.